Tibial plateau fracture. This was my leg. This was me 6 weeks later dancing salsa and doing CrossFit. Sure, I still had a little bit of pain, but obviously not enough to stop me from doing this. The process is easy. It's not hard. It just takes a plan, a system, and a little bit of patience and learning how to listen to your body. And that is why I built this online program where your first 10 days are free. These next videos where I go over how to massage your leg, how to work on the scar itself once your stitches are out, so we make sure it's more supple and it looks better at the end of the day. And a few different exercises you can do along the rehab journey are all from my online program. I am creating a free Facebook group right now too, where I can start to help people understand the steps they need to go through and give someone they can speak with, because unfortunately many of the doctors and physios either don't care or don't know, and that's what I want to change. So if that is you and you want to do this, watch the videos, join my Facebook group, check out my free online program, and hopefully I will see you in one of those places very soon. All right, so just a little bit of an updated massage video for people that are a little bit farther in the program now, or just have less pain. Now you can see all the massage techniques are the same, but you can see I'm really starting to push harder now. Especially when your wound is completely closed, then you can go to town. Now, one of the areas that I really like to work on is I would bend my knee a little bit. I'm gonna bend in this direction. This might not be possible for you guys at the moment right now, but it's gonna be right above this knee area, so this outside of your knee. This, often can really be a tight trigger point that causes a lot of issues. So really start to push in this area and also get into that IT bend, just like this. I mean, obviously you don't need to sit like this. You can sit back. You can really kind of just start working on the leg, but you really want to start pushing in now, if you're able to, harder. The other area I want you guys to focus on is gonna most likely be down in this muscle right here. It's called your anterior tibialis, and it's right in front of the screws, basically. They move this aside to put the screws down, and then this goes back over. So a lot of times we have a lot of pain here. I'm going to show a very cool foam rolling exercise that I'll put directly after this video that you can also do, but I'm just really taking my thumb and working on this area just like this. I'm going to show the same thing that I do with the scraping tool, but right now you can just see that I'm really going in here with my thumb and just really trying to release everything. And you can also do the same thing with any trigger points you have on your calf. This is not much of a different video than the beginning, but right now you can start to see I'm working harder on my body, on my muscles. I'm pushing more. And now continuing with this, I also like to go into this posterior portion of where the tibia is. So my bone is right here, the bone that we broke. And as we start to go back here, you're gonna start to realize sometimes right here, this shoots directly down to your foot. That is because we have a nerve that passes through here. And a lot of times this little guy gets entrapped. So just working on this, you might realize that just right there, you feel that zap going down to your toes. But as you do it, it starts to get better and it starts to get less. Well, that means you're releasing it. And if it doesn't release, don't worry, your leg's not gonna fall off, you're okay. Push hard, but just make it comfortable for yourself, right? And if you have physical therapy, you can show your physical therapist this video, or you can also show them how you do it and ask their opinion. Here is my scar. I also really suggest now starting to work over that scar. Now you might realize that when you feel the plate, it feels a bit numb. That's actually kind of normal because your bone is probably still a little bit traumatized from everything and the nerves have not really reconnected from everything. So it actually makes working the scar tissue under the scar directly on the bone usually one of the less painful spots, ironically. So here, I'm just working on that area there. And then also, here's my patella. So what do we call that patella? The Kniescheibe, that's the word in German. What is I can't remember the term my mom would use to call it, right? I just remember it as the patella. And what I'm doing here is I just grab around my leg. You can do it however you want. This just gives me a little bit of pressure. And this is great because now I can go under the patellar tendon. Now, if this hurts you, it could be that you just have patellar tendonitis, because I think almost everybody with an office job does. And so that's okay. Don't worry about that so much. And just focus right there, working here, and also on the inside, because that's most likely where your drainage, not pipe, tube was. Sorry, sometimes switching between English and German, I lose some of the basic terms. And you can see I'm just going on the inside of my leg and just working right below that patella. And I'm pushing a little bit harder. That's the point of this kind of advanced massage video, is the massage doesn't get advanced, it's just the pressure becomes more, and that is what makes it more advanced. And I'll add one more in there. I'm gonna show you on this leg, but it's right behind the tibia. So I'm gonna do that here. Obviously you don't have to sit in this crazy position. You can get in a comfortable position. But what I'm doing is I'm driving my thumb. You know, I'm just gonna switch my leg just so you can see what I'm doing. So I'm now working behind my tibia, and this is also a very common shin splint area. So if this is super painful too, maybe check the other leg, like what I'm doing right now, because you might just realize it's bad on both, because when our arch is weak, a little more information than you need to know, then often it flattens and that pulls this tendon and it irritates the area against the bone. That is what shin splints basically is, posterior shin splints. And so here, obviously I'm doing it on my other leg just due to camera purposes. And you see sometimes I change the angle of my hand just because it's more comfortable. I won't do it for the video because I want you guys to see what I'm doing, but you can do it easily on your injured leg too. If you're not able to bend it so much, that's fine. Keep it as straight as you need and then just work in the area. The only problem is if I do it like this, you don't see what I'm doing, which is why I use the other leg for that purpose. All right, so scar tissue, when your wound is closed, mine on the second round got a bit infected. That's why it looks a bit gnarly, which is too bad because it looks so good after the first surgery. But basically what you can do here is just softly start going over this area. Now you might find out that this area is, funny enough, the most numb. That makes it actually a little bit easier because then you really don't feel it. But what we want to make sure that we do is this area right here where the scar is, you're going to have scar tissue directly underneath. We need this to get as soft and supple as possible, and that will happen by us just softly working on it like this. If you still have your bandage on and you still have staples or stitches, you can do the same thing but just very soft, because you know, the stitches are in your skin. So it's not only talking about irritating the wound or the injury itself, it's just the skin. So even if if you do have stitches or something in there, just go softer, because even if you didn't break your leg, the stitches would still irritate the skin. In this case, you can see that I have nothing, so that allows me to work directly on the scar, and also you can then push next to the scar. And if you find some areas where it's a bit more numb, you find a ball underneath or whatever, stay there a little bit longer. I'm gonna go directly into how you can use the tool also. You can grab a small spoon or anything actually, and just softly go over the area, just like this. You can see sometimes I pull the skin back, you can leave the skin open. There's literally no wrong way you can do this. I would highly recommend making sure that the wound is completely closed before you do something like this. A lot of times when you go over where the plate is or was, mine was taken out, mine was there, you're gonna feel maybe a little bit more numbness or maybe a little bit more pain. That's okay, just go a little bit more light there. And a little bit of a tip is right back here is gonna be where your tibial nerve passes. This is pretty wild. So for me, this was a very interesting area because this nerve would often be entrapped. It would zing all the way down to my foot when I hit here, but then when it released, it was always much better. So again, go light, no need to scare yourself or terrify yourself or feel like you're causing any damage, so just push there very lightly. And you can also then go into the shin. For me, right here was extremely painful. I'm not really sure why, because a lot of my clients since then has had no issues right there at all. But for me, I really enjoyed going down into the lower leg and just softly scraping the entire area. All right, so other great exercises we can do when we're really not able to put any body weight on our leg is we can do hip flexion, just like this. This is fantastic because we can do this in all different directions, bending the knee, keeping the leg straight. And my break was so bad that the gravity in this position just hurt my knee due to the scar tissue. So this was great for me to kind of just get some blood in my lower body, move my hip around, also get a little bit of knee flexion. But we can go from this position and we can do the same thing. I'm gonna pop forward here a little bit, backwards. So I'm putting no body weight. I'm not even touching my leg on the floor, and I'm able to get all these different positions that we're gonna need when we start to walk again. So I know there's been some fear I've heard about in some of the Facebook groups where people think they're gonna have to learn how to walk again. Don't worry about that. I've never seen that in my entire life, and nor did I have to experience that myself. However, doing stuff like this is gonna help the muscles not atrophy, because little scientific fact for you here. When we don't use a muscle, so in this case, when we're not even allowed to put the leg down and we're like lying in bed all the time, it takes 24 hours for the muscle to start to atrophy. So now, fitness-wise, we don't have to worry about that because we're moving around, we're walking. So if you didn't do your abs exercise in the last couple days, don't worry about it, because even just moving is working your abs. However, with our injured leg, it's a completely different story because we're not using it at all. So again, going into this hip flexion, yeah, okay, so both are hip flexion. This is straight leg hip flexion. This is hip flexion with a bent knee. Hip extension, coming back like this. And also like the hip extension, but you can do both at the same time if you want to work on your coordination. Or you can also just move it like this to get some of that range of motion and blood flow better in the knee. And you can also test your range of motion against gravity here. And also scar tissue and kind of good pain versus bad pain. What is the difference? How does it feel? And like I say in many of my videos, if you reach a point where it's a bit painful, try to massage. So like in this case, sit down, massage the area, come back up and see if it gets a little bit better. And then you start to understand what is limiting you through the progression of your like rehab. Like, is it actually the knee and the break and the screws and the plate, or is it just more a little bit of tight tissue, adhesive tissue, or some inflammation, or just the fact that it's early morning and you haven't gotten the blood flow in your leg yet, preventing you from moving farther? Because if it gets better, then it was the latter of the two. And then again, you start learning more about your body and also this concept of good pain versus bad pain.